So now going on to the anterior muscles of the shoulder. So there are three muscles to know about. The first is the deltoid. This attaches from the acromion and the scapular spine, so it kind of originates from both, onto the humerus. So there's a specific tuberosity that it attaches onto. Pec major is the second muscle. So this attaches from the clavicle, the sternum and the ribs. You can see that it comes from all three areas. And it attaches onto the intertubercular groove onto the humerus, which is also where teres minor attaches onto. And serratus anterior is the third muscle to know about. And this attaches from the ribs and inserts onto the medial scapula. So it doesn't actually show on this diagram, but it goes onto the medial aspect. So it kind of goes under the scapula and then attaches onto the medial aspect. So this shows what movements they're responsible for. And like with kind of the compartments of the arm that we were talking about, if you think about what happens when the muscle shortens, and if you know where they insert and attach, you can usually work out what movement is. But I'll just go over what kind of the key movements are. So deltoid is very important for abduction and also has some role in internal and external rotation, as well as flexion and extension of the shoulder. So it's quite an important muscle in the shoulder. And it's supplied by the axillary nerve, just like teres minor. The pectoralis major carries out adduction, as well as flexion of the shoulder and internal rotation. So because of where it attaches, as it pulls on the humerus, it pulls the humerus in towards the chest. And it's supplied by two pectoral nerves. And the serratus anterior carries out protraction of the scapula. Now if you think about what was to happen if these nerves fail, so if the axillary nerve was to fail, you'd have failure of the deltoid, and you'd have a patient who wasn't able to raise their arm to their side, especially because the axillary nerve also supplies teres minor. They'd also have weakness in rotation. Failure of the pectoral nerves, which isn't as commonly seen clinically, but that would result in quite a weak adduction. And failure of the long thoracic nerve, classically, results in something called a winged scapula. Scapular protraction, so the way you would elicit it in clinical examination is you get a patient to stand against the wall and push against the wall, and you'd expect to see their scapula kind of stay in place. With a patient who has long thoracic nerve palsy, they'd get winging, so the scapula wouldn't stay in place and it would just kind of come out. So if you Google a photo of it, you'll see what I mean. And I'll go over it again in the next lecture. So just a summary of the anterior shoulder. It's fairly straightforward. There are three muscles: the deltoid, pectoralis major, and the serratus anterior.